it's Karen from Beyond IVF Baby Channel. I'm so glad you're here. Today, I wanted to take time to speak about reproductive immunology. I worked with Rosalind Franklin University Health Systems, part of their Reproductive Immunology Center. That was based out of Chicago, Illinois, the suburbs of Chicago. And I really have a lot of positive feedback from being a patient for about 5 years with them. They changed my protocol slightly as necessary, and I made the changes they recommended as I continue to have miscarriages and failures without kind of going with all their prescribed protocols. So a little bit about reproductive immunology. It is a very specialty niche. As of last check, there is less than 6 in the United States, many of which do not take insurance. I did consult with Dr. Berberine when he was still alive. It was a very famous, well-renowned clinic out of the New York, Long Island area. Very expensive, does not take insurance. I opted to wait and work with Dr. Kwak-Kim. I think I first heard positive feedback about our clinic on the forum Inspire, on their fertility chats. And then I joined the Facebook group, so I learned even more about them. And I found a lot of good information. I knew I had to be patient. It would probably take about 8 months to get my first appointment. However, from there, for me, it was smooth sailing. I only went there twice. First time was for the initial blood workup and ultrasound for both my thyroid and vaginal. And then I also did see them just before I did my successful IVF transfer. So from the different modalities and what I did or what they prescribed, for a lot of their patients, there is some kind of thyroid dysfunction. So I was on thyroid medications. They checked my levels at least monthly, sometimes more frequently. Of course, we checked the inflammation levels, NK killer cells, cytokines. We also did other things such as Beyond Levonox when it was ovulating or confirmed pregnancy. A lot of times other REs and or OBs, once you're pregnant, thought some of their, I guess, theories were strange or they've never seen them before, but ultimately, who cares as long as it works and you have that healthy, successful pregnancy and baby at the end. That's all that really matters. So I did everything they prescribed to me. I did Metformin. I did, even though I'm not diabetic, and I did not have PCOS at that time. While some REs will prescribe testosterone, they were not an advocate for it, but DHEA was okay. They advocated for that when necessary. Besides the Metformin, the Levonox, which is good for inflammation, it's also good in other regards, especially if you have different blood factor disorders, which I did. I also had to do the inflammatory medication, Rayos, and I think I had to stack some others on top of that. I also did something called, that's the bulk of it. I did extra hormones for support. Again, the OB thought it was a little bit crazy. In his 20 or 30 years, he hadn't seen anything quite like it, but hey, it worked. So ultimately, working both with Dr. Kwak-Kim herself, who is heavily into research as well. She manages so many patients on an annual basis or probably even a daily basis, but she also does the actual clinical research studies with the patients in terms of trying to get to the bottom of what can we do for these women who are having repeat miscarriages or have some kind of anatomical abnormality that's causing issues for sustaining pregnancy. So I would say if you've had miscarriages, if you're over 35, if you're not getting or staying pregnant, it's worth a shot to explore the world of reproductive immunology. I think they are taking United Healthcare insurance again. There was a while they stopped, but I think they're back on it. And I have also heard there's been some changes in terms of the team. So not everybody maybe you won't hit it off with everybody, but I can say Dr. Kwak-Kim is very professional. She gives it to you as it is, and she's open-minded. Heather, I've heard, has since left, which is, so sad because I loved Heather. I worked with her a lot as well. I think in the end more than with Dr. Kwak-Kim. I think I worked with Dr. Kwak-Kim for about a year and then Heather for the remaining 4 years. She was amazing. She was extremely empathetic, sympathetic, wonderful person. So I really truly suggest, if you need some extra support, reach out to an RI. And I definitely think the Rosalind Franklin University Health Systems Fertility Reproductive Immunology is a very great place to get that extra support. And I wanted to do an ask. If you're finding this this content of value, I would appreciate your support with subscribing and liking my videos, and also if you can share it to other women on the journey who are struggling. I might have a topic that can be of interest and actually help them reduce their journey. And of course, if you have a topic idea, I would love to hear it in the comments. With that, ciao for now. I can't wait to tell you some more little nuggets of what I learned in my journey next week. Bye.